Can a 90% heart blockage be treated just with medications? If I take medications alone for a 90% blockage, is it safe enough in the long term? That's because medications work in two ways. Number one, they help to stabilize the plaque. Is it reasonable to treat a 90% blockage just with medication? Can all of them be treated just with medications initially? No. Hi friends. Today let's talk about a very important and a very common question that my patients ask me all the time, and that is, can a 90% heart blockage be treated just with medications? So my friends, this is a very common question, and this question is asked by patients because they know that invasive procedures like angiography or stent placement can have more risk than just medications alone. It would make sense to avoid invasive procedures in favor of medications. This is a very common question. So let's take a deeper dive into it. When someone has a 90% blockage, there are two questions that we have to answer. The first question is, will the 90% blockage reduce by taking just medications? For example, will it become a 40% stenosis from a 90% stenosis if I take medications? And the second question is, if I take medications alone for a 90% blockage, is it safe enough in the long term? So friends, let's answer the first question. We have seen that a 90% blockage does not reduce in size or severity just with medications. For example, if we do angiography for a patient and we find a 90% blockage and we repeat an angiography after 5 years of the patient being on medications, then we see that the 90% blockage is still 90%. If anything, it may actually get bigger or worse, like a 95% blockage, but it usually does not reduce. Then what is the role of medications? Why are we giving medications if the blockage does not reduce by medications? That's because medications work in two ways. Number one, they help to stabilize the plaque. Stabilizing means that every plaque has a cap on it, a fibrous cap. And when this fibrous cap is ruptured because of any stress, then platelets come on top of it and build up on each other, and this rapid accumulation of platelets and inflammatory cells is the reason for a heart attack. So if we can stabilize this fibrous cap, then we can minimize the chances of a heart attack. And the other reason is that medications reduce the cholesterol level, the bad cholesterol level that is inside the plaque. So it helps to prevent the progression of the plaque. So medications are extremely important to make sure we stabilize the plaque and reduce its progression and decrease the chances of that 90% plaque causing a heart attack. So we have answered the first question, that medications help the 90% plaque, but they do not decrease the 90% plaque. Now let's answer the second question. Is it reasonable to treat a 90% blockage just with medications? So friends, this is a complicated question with a little bit of a complicated answer. So let's try to understand this. When someone has a 90% blockage, we can divide them into two scenarios. The first scenario is if someone has had a heart attack. If someone has had a heart attack or very unstable angina, meaning they are having chest pain, let's say every day, or they are having chest pain with minimal exertion, then we call it unstable angina. In these situations, we do not wait just for the medications to work on a 90% blockage, and we go ahead and place a stent, or we may recommend open heart surgery. But if a person has a 90% blockage and they don't have a heart attack or unstable angina, and they have what we call stable angina, meaning the chest pain has been going on for a long period of time, maybe 2-3 months, it occurs with exertion, is relieved with rest, is not happening every day, maybe it's happening once in a couple of weeks or something like that, then we call it stable angina, meaning the plaque is not threatening a heart attack. In that case, we do recommend that we try only medications even for a 90% blockage first. And if the medications fail, meaning even after taking medications to relieve your chest pain, you are still having chest pain after, let's say, a month or so, only then we recommend treating that 90% blockage with a stent or surgery. Now, another caveat to this. Let's say someone has stable angina and they have a 90% blockage. Can all of them be treated just with medications initially? No. If the left main artery or the proximal LAD artery, these are the two big arteries in the heart. If one of these arteries has a major blockage, then we recommend that we should go ahead and put a stent or do surgery for that blockage, because that is a major artery and we don't want to wait for a month or so to fix it. But if the 90% blockage is a distal part of the LAD or the RCA or the third artery of the heart called the circumflex, then studies have shown that it is very safe and actually effective in most cases to try just medications alone, even for a 90% blockage. So friends, let's try to summarize our discussion. The first point is that the medications do not reduce the severity of the blockage over time, but they do help to stabilize the plaque. The second point is that if a 90% blockage has caused a heart attack or unstable angina, then we must fix it with a stent. The third point is that if the 90% blockage is not in the left main artery or proximal LAD artery, then it can be safely treated just with medications alone, as long as you're not having severe symptoms or severe chest pain, you're tolerating the medications well, and if the medications have taken away your chest pain and you don't have medication side effects, then you can be safely treated with medications alone and you don't necessarily need stents or surgery even for a 90% blockage. So my friends, hopefully we were able to shed some light on this complicated topic. If you have any questions regarding this topic or you have any other complex questions, please don't hesitate to leave a comment for me and do not forget to like and subscribe our channel. Thank you.